My name is Benoit Tas. I'm the co-founder of NeuroPath, a Belgian-based startup. We are basically working with patients that are suffering from Parkinson's disease and trying to improve the quality of their life by implementing new technologies so they can share data with their ecosystem of caregivers and clinicians. The tipping point was me reading a book in the summer of 2016 by John Palfreman, an American journalist who actually became a person with Parkinson as he was writing the book. The book was called Brainstorms, The Race to Unlocking the Mysteries of Parkinson's Disease. And there's one particular quote in that book that struck me. It's a quote by Sara Rigare, a Swedish woman who was experiencing the first symptoms of Parkinson's disease when she was 13 years old. And more than 20 years later, she has now gotten her PhD from Karolinska Institute. And so she's very much a patient advocate. She very much believes in patient empowerment. She calls herself impatient as opposed to patient, impatient to find a solution. And the quote from her was that she spends 2 consultations with a neurologist every year, which is 1 hour of monitoring per year by the neurologist, versus 8,765 hours where she's in self-care. And so the fact that we would be able to deploy these technologies to allow these patients to collect data and not be in self-care anymore, but connect it to their ecosystem of caregivers and clinicians, I think that would be amazing if we could realize that vision. We're basically a digital platform, so we use existing technologies in motion capturing, in quality of life surveys, wearables and voice, to allow the patient and the immediate caregiver of the patient to capture data from the daily living of the patient, to be able to create insights from those data and then share those insights with an interdisciplinary team of caregivers and clinicians so that they can intervene quicker when they see there's a deviation or when there's an event that's being detected in the life of the patient. We do that because Parkinson's disease is a very, very individual disease. And today the gold standard is that the patient maybe sees a neurologist twice a year during 30 minutes. So it's 1 hour in observation versus 8,765 hours where the patient is having to go through self-care. We've been doing pilot tests with motion capturing, both in the laboratory environment and with gold standard motion capturing tools, but also at homes of patients. And so what we do is we capture the patients as they're doing their physical therapy at home or as they're doing their typical Parkinson's disease exercises to assess the state of the disease. And a lot of patients are motivated by that. I mean, I can have probably 100 quotes of patients, but I'll give you one. It's by Russ Bradford. He's a Parkinson patient, but he's also the founder of a patient association in the UK called Parkinson Concierge. He says, I don't think there's going to be a cure for Parkinson in my lifetime. However, focusing on the quality of life of the patient is so important, and that's why what you're telling me, what NeuroPath is providing, is exactly what we need as patients. When we talk to patients, they're all very enthusiastic about the solutions we would propose. But healthcare is a slow industry, and so the decision cycles are long, which on the one hand is very comprehensible because you're talking about people's health, but on the other side, you know, the technology is there and there needs to be a drastic change in healthcare